I think a lot of these people you'll have met today, these are the Consumer Research Panel in North Trent. It's nice to put faces to the words, but this group of people, a group of people that I met recently when I went to Guy's Hospital, I was invited there to the first ever meeting of the South East London Cancer Research Network Consumer Research Panel. And you can see there's an age range there. The young lady in the middle of the front row had come along with her mum, this lady sitting next to her, and spoke about her wish to go back to school and to talk about the things that she was hearing at these research meetings. And she'd actually done an assembly in school where she'd spoken about her mother's work in the cancer research field. There is one interloper in that photograph. The lady in the middle of the back row is Maggie Wilcox. Maggie Wilcox is, again, another lady who's been an inspiration. She's a member of the Surrey, West Sussex and Hampshire SWISH Consumer Research Panel, but she's recently set up a group of patients called the Independent Cancer Voices, and you can look that up on the World Wide Web, and they're pushing back the boundaries of what a consumer research panel is and what it can do. Great lady, Maggie Wilcox. And Dave asked the question, what kind of research can patients and carers do? And that's a quick sketch of the research cycle, all the way through from identifying topics and asking questions that need to be, all the way through to disseminating, speaking at lectures, helping to implement the research findings. And there are, honestly, Dave, members of the public who've been involved at every step in that research cycle. I've seen this slide before. Jonathan had it in different colours. I'm going to stop handing out my slides. I probably gave it to Leslie in the past. But 10 years old. It's its 10th birthday this year. And if you want to build a consumer research panel, you need the 4 cornerstones of a consumer research panel. And these are individuals who I couldn't leave today without mentioning. Sam was the clinical lead. Sam was the impresario. He was the person that sort of pulled the strings on the puppet theatre. One of the my very early meetings with a young man called Tony Stevens, and I've not been able to find Tony Stevens to invite him along today. But Tony Stevens, how important was the North Trent panel? Tony Stevens was a member of Sam's academic department at Sheffield University, and in 2001 effectively became the first facilitator of the Consumer Research Panel. But because of the work he'd done in Sheffield, he was appointed to lead the National Consumer Liaison Group, the first facilitator of the Consumer Liaison Group. And those of you that have met Karen Innes, and I know there are lots of people that have met Karen Innes replaced Tony, but it wasn't an easy job to do. She's done it very, very well. But Tony led that group and led it for a long time, and he was part of the induction training that Sam spoke about, that 5 or 6 of us here, Shirley, Harrison and 5 or 6 of us who are in the audience today, attended. Tony Stevens was speaking at that clinical induction session, at that training session. I asked him a question and he invited me to join the National Lung Clinical Studies Group. Sue Button, probably more important even than Sam was, but Sue Button held the panel together for a long time, for 7 years. Did some fantastic work, over and above any brief that you could possibly write for what I might call a clerical administrator. Karen Collins replaced Tony Stevens as the facilitator when Tony went national. Karen came in from Sheffield University. She now works at Sheffield Hallam University. Jill Thompson I will come back to, but Jill Thompson took over the clerical work when Sue retired and worked for us for about a year. She was at the time doing a PhD thesis at Sheffield University, and she was just about to sign a contract to stack shelves at Sainsbury's, I think, when we roped her in to help with the CRP. And her doctoral thesis, was about patient and public involvement in research. And Jackie Gaff, who I've spoken about, took over the reins from Jill Thompson and carried on the clerical work, and she's been responsible for arranging your involvement in today's work. The first chairs, I think, of the panel were Karen Willman and Dawn Ragg, and both of them have passed away as a result of their cancer illness. But good chairs, different type of people at Dawn and Karen. They came at the world from different angles, and they put them together, and they made a very substantial team, a fantastic team that saw the panel through its formative years. They are two of the absent friends. There are lots of other absent friends. Karen is absent today and sends her apologies, even though she's still the facilitator of the panel. But she's got issues at home, and believe me, if she could have been, she would have been here. But the current members, these are the cornerstones: the clerical administrator, a clinical lead, a facilitator, good members and strong chairs. And if you want a panel, I think you need all 5 of those things to be in place, otherwise they're going to struggle. So why involve patients in research? What sort of impact do you get? And you can find academic papers written about the impact of patients and public on cancer research, and these are the kind of statements that you get in the literature. Impact of user involvement is subtle and mainly the achievement of a well-informed and motivated cohort of participants. And that's what I'm talking today to, the well-informed and motivated cohort of participants. How we get the message through to the less well-informed and less well-motivated members of the public is part of the ongoing debate. But if you do involve these people, you get richer data and an enhanced credibility of the research findings. It said that users tended to focus on research which would look good to patients, while experts focused on what was feasible. So again, that's refinement of the question. But impact may be in terms of methodologically or ethically superior research, or more relevant research, more likely to influence practice and hence improve health outcomes. And Jill Thompson, who is in the audience today, could you stand up, Jill, please? Could I embarrass you? Thank you. Jill is there. If she does, she's not going to stand up because she's very close to a full-term pregnancy at the moment, and we all wish her the very best of that. She didn't want to stand up today because she thought the stress might have sort of precipitated things. But Jill's PhD thesis, and she's happy to talk to people about this, really explores in depth, and it's about 2 inches thick, and don't drop it on your toes, or it will cause serious damage. Jill explored the relationship between patients and the public in these research groups, and these are her words, not mine. She explored the following questions: how do the involved public and professionals rationalise and account for public involvement in health research? What roles do the public play in health research? How is the voice of the public integrated into health research spaces? And what counts as credible expertise in research decision-making groups? That last question, seriously difficult question to answer. But I've listened to Jill speak. She spoke at the last Involve conference in Nottingham in November of last year, and with tongue firmly in cheek, she was asking questions about the professionalisation of patients and to what extent that's a problem in patient and public involvement. Those of you that are members of the public, those of you that are patients and carers, and she's made me look at my life and ask the question sensibly: to what extent are we becoming over-professionalised and a part of the establishment? And at what point in time should us over-professionalised members of the public step aside for a fresher, more recent experience coming from new people? And she asked the question: should the public engage in techno-scientific speak in order to be heard? Because believe me, these conferences aren't always as easy to access as the ones that we've had today. We've had some fantastic speakers who've managed to turn very, very difficult scientific concepts into the language that a lay audience can understand. And I'm grateful, and I'd like to thank all of the speakers for doing that today. Is it important that we, as patients and public involved in the research world, become competent at using this kind of language? And final question for us, are we opening up expertise to new questions and perspectives, or are we just letting people see the experts at work? Are we just being invited along to watch and to applaud and to say, well done, you're doing a fantastic job? Or are we really asking the questions? And if I thought that was the case, then I would go and play golf this afternoon instead of being at this conference. Because I think the answer to that is that given the quality of public and patient involvement that I've seen over the years, locally and nationally, that we're doing much more than that, and that we are having an input that makes a difference and that matters. What kind of things do consumer research panels do? And I just pulled these at random from the last quarterly report of the North Trent panel. And there's some interesting stuff up there. Research into cancers of an unknown primary, led by Philippa Hughes at the Academic Unit of Supportive Care. Sam's spoken at length about the involvement in the Cancer Survivorship Project. A study on testosterone replacement in young male cancer survivors. And James Ashton arrived hot foot from his university lectures this morning, sitting in the audience, attended the first meeting as patient representative, and believe me, James will be making his voice heard. Linda Wild, breast surgeon, study about decision-making in high-risk familial breast cancer patients. The work on the Sheffield Teaching Hospitals NHS Foundation Trust. Shirley Harrison, non-executive director, chairs the Trust's Organ and Tissue Donation Committee, and wouldn't it be great, if Shirley would have been able to come and speak to us about that. Karen Collins and Tracy Green, working on the Research Design Service, Yorkshire and Humberside Patient Involvement Panel. National Institute of Health Research, Jane Hughes involved as lay reviewer for the NIHR Technology Assessment. I could have done 10 slides like that about that kind of project that consumer research panel members are involved in.